Hello everyone, my name is Dr. Barnali Bhattacharya and the lungs of my asthmatic children is the heart of my practice. Today I'm going to tell you something really important, that's the misuse of the nebulizer. I've been wanting to do this talk for the longest of time, it just kept getting postponed, but now I think it's high time. A fortnight back, there was a lady on my neighborhood WhatsApp group who very innocently asked that, hey, does anybody have a nebulizer? And one of her friends responded, yes, I do, and you may borrow it. I was gobsmacked. I actually texted both of them and I told them why it's not such a good idea nebulizing at home. And I also wanted to know what her child had. And she said, just a sore throat. What is a nebulizer? A nebulizer is a device with which we deliver drugs in a mist form into the lungs. Yes, it has a role in asthma, in cystic fibrosis, in COPD, but under doctor supervision. What happens here frequently is that nebulizer is used for cold and cough. We have patients walking into the clinic and asking us, do you have a nebulizer? Because our child has cold and cough and we want nebulized. Of course, my staff sends them away and also explains to them as to why we are sending them away. Now, if you would have seen one of my earlier talks in which I have said that where the drugs work in asthma. So the nebulizer is not your cold and cough gadget. A nebulizer is when the doctor delivers drugs into the lungs to dilate the airways. A nebulizer is not for you to use at home by just pushing saline or water into it. You can do great harm. And is a nebulizer at home a great idea to use if you know your child has asthma just by bronchodilating? Not at all. Because you might misjudge the gravity of the situation. And you might keep giving the reliever and you might push the child into something more sinister. When there is acute breathlessness in a child with asthma, we need to use the nebulizer with an oxygen drive because the child then is hypoxic, meaning the oxygen level in the system is low. So the oxygen is needed much more at that point of time than bronchodilating. And something that I see all the time, 50% of the children who come to me fresh for asthma, either referred by colleagues or referred by another family, or they decide to walk in straight, 50% of them have a nebulizer at home. And they've been masking this child's disease. Why? Because every time this child has cold, cough, and a little breathlessness, the family just bronchodilates them. The child gets okay, only to trip again. As I've said in one of my earlier talks, that the mainstay of asthma management is inhaled corticosteroids by an inhaler and a spacer. And let me tell you another thing. If you think that a nebulizer actually delivers better drug into the airways and lungs, that's an absolute wrong notion. The MDI, which is your inhaler, with a spacer actually delivers much more drugs into the lungs and much less drugs into your oral cavity. The nebulizer deposits most of the drugs into the oral cavity so it can give more side effects. So if you're using the inhaled Respule, which is a steroid, it is as good as taking oral corticosteroids. So my request to all of you is please do not buy a nebulizer from the pharmacist or a nebulizer online because you are doing great harm to the child. And if there are any colleagues who are looking and hearing this video, I would say to them that it's time for us to stop this forest fire. Please do not write any nebulizer for home use. And if you have to use a nebulizer, Even for delivering drugs in your own clinic, try the MDI with the spacer. Let us not get our parents hooked to a gadget which they don't know what harm they can do. It's our responsibility too. A nebulizer's role is only when there is an acute severe attack but with an oxygen drive. Thank you so much for listening in. Thank you.